Hi, my name is Dr. Abid Khokar. I'm an interventional pulmonologist at Norton Thoracic here in Phoenix, Arizona. I see a multitude of patients. They are either COPD, lung nodules, lung cancer, anything in that spectrum. My specific area of interest is lung cancer, early diagnosis and treatment. So high-risk patients are defined as patients who have smoked for a very long time, either what we say is a pack year, a 20-pack year smoking history, and that's a pack of cigarettes per day for 1 year. So anyone who's smoked for a long period of time is within a certain age range of 50 to 80 years. The recommendations are that we do lung cancer screening for them. The low-dose CT scan allows us to screen the lungs for any early tumors that may be present without a very large radiation dose. A standard CT scan would give us a dose of around 500 milligrays, while a low-dose CT gives around 1/5 of that at around 100 milligrays. It's important that we don't add any risk to people when we screen them, and allows us to achieve what we want with less radiation. The issue with lung cancer is that sometimes early stage lung cancer may not have symptoms. And most of the time we don't see symptoms with lung cancer until people are pretty advanced stage, maybe stage 3 or stage 4. So I would say that the average patient that has lung cancer may not even know it. The advice I would give for a patient that's high risk is talk to your doctor. See if you fit the criteria for lung cancer screening, and if you do, get screened. Like I said before, only 2% of patients in Arizona are being screened right now that are able to be screened. If you look at the national average, 6% of patients are only being screened in the country. That's about 8 million people fit the criteria for lung cancer screening. If we only caught half of those patients, we could prevent 12,000 deaths per year. My suggestion for if you have a patient that's high risk that fits the criteria for lung cancer screening, ages 50 to 80, with a 20-pack year smoking history, who is still currently smoking or hasn't quit for more than 15 years, is get them screened. The reason being is that early detection of lung cancer in stage 1 or stage 2 has a significant mortality benefit. The average stage for diagnosis for lung cancer is stage 3, and mortality rate is not very favorable at that stage. So that's why it's important to get your patients screened early. My patient care philosophy is I'd like to give time to my patients, let them ask all the questions they want, getting them in at a quick notice. Sometimes providers need an urgent opinion on their patients, and we have to be available to see them quickly. It's a new state-of-the-art facility that allows us to get our imaging and diagnostic testing on our patients quickly and easily. It's important because it allows us to get timely studies on our patients. Sometimes getting approval for CT scans or PET scans and getting them in a moment's notice is difficult, and allows us to get it done really quick. So if a patient unfortunately gets diagnosed with lung cancer, they're going to have a lot of different scans that need to be done and have a lot of different providers that they'll have to see. They may have to follow with a pulmonologist, an oncologist, as well as a radiation oncologist, and possibly a surgeon as well. All these different physicians are going to need different tests, including MRIs, PET scans, CAT scans. The reason why the partnership is important is because we'll have a single place for us to order all our scans at, with good radiologists to read our study on a timely basis.